What's going on, Fasciablasters? My name is Jasenia. I'm a licensed massage therapist here in the state of New York. For those who don't know me, I wanted to pop in and make a quick video for you ladies for blading. I know a lot of you have questions in regards to what it is, what it does, and how to use it. So this is exactly how I'm going to explain it to you. So I know a couple of you had a question as far as your Gowasha tools. Okay, so you can use them. I mean, there's no issues with you not being able to use them, but I'm going to show you, if you do have them, how to use them. We're going to be using these tools as scanners. We're not actually going to go in there and start creating inflammation. That's why we have the Fascia Blaster. So these blades are only going to be used for almost like Ashley called them the other day, like basset hounds. They're going to help us to be able to find them. I think they're perfect tools to search for sticky fascia, like I like to call it. So before we go into how to treat your fascia using these tools as finding as scanners, I want to be able to first explain to you each and every single tool I have at hand. Okay, so most of you probably have these tools already. Some of you are probably still in the middle whether or not you want to incorporate them in your treatment, but I'm going to explain every single tool to you. And you'll find which one works best for you. So first I want to start with the Gowasha tool. This one you probably all have, maybe made out of plastic or horn. You probably have one of these, but I like to work with stainless steel, medical grade. It makes it easier for me to find adhesions only because the plastic and horn bend. They have a little give, so when I go to treat, it's not giving me what I'm looking for. So that's why I don't work with the plastic or horn. I like to use the stainless steel tools. So Gowasha tools are made to just go one direction, one long stroke rather than the back and forth. Always use your tool at an angle and pick up and down, and that's going to help you find any of what I like to call sticky fascia or fascial adhesions. So that is the Gowasha tool for the ladies who have the Gowasha tools. Okay, I also wanted to show you another tool called the edge tool. Now this tool, as you can see, has one beveled edge. Okay, which means you can only use it one direction, not back and forth like this. Okay, so having an angle like this, like the edge tool, gives you the ability to work at an angle and really scan for those adhesions, but only in one direction, just like that. So the next tools that I want to talk about are the smart tools, but I know a couple of you ladies have these tools, but they're not made by Smart Tools. So this one looks like a little handle, but again, this tool is only meant to do one direction. This one doesn't have a beveled edge. So this would be pretty much, this would be really good for your legs. One direction. So you would actually be treating yourself this down, or whichever direction you want to go, depending on how you hold your tool, okay? But always at an angle, never straight down, okay? Just like that. You want to scan for adhesions. So that would be, this is made by Smart Tools. You can buy them separately or you can buy them in a set, but you can also find tools like these that looks like this on Amazon, okay? And I'm just going to show you other tools that Smart Tool makes, okay, that are excellent scanners. Okay, that's one. That one looks like a fish. This is another one, also one beveled edge, so you can only go one direction. You can go down, you can go up, but never back and forth, okay? This is another one we call Batman. This is great for again, to get into certain areas that are hard to get into. All right, this one is beveled, so this one we can go back and forth with. Again, we're just using them as scanners. So this would be great for scanning any of my areas of restriction or adhesions. And then we have Captain Hook. Again, it's made by Smart Tools. You'll see a couple of ones that look just like this too. All right, again, these are for small areas, such as your forearm and between your fingers. Okay, get it in the thumb. You want to scan for any adhesions in your thumb. These are great. And then you would go in with the face blaster. Okay, and last but not least, my favorite. These are made by Rock Tape. This comes in a set, in a box. Ashley has this in her Ashley Black Guru store. Check them out, they're awesome. They may be a little expensive, but again, you want to invest in you, and I think these are great investments, and a great investment for you. And so this one is the Mallet, and this one's the Mullet. They also make it in plastic. They also make Mallet made out of plastic. You guys may be asking what's this for? Well, after your treatment, you can crack open a beer. Yeah, it is a beer, you know, bottle opener. It's exactly what it is. And so these are to mimic the knuckles. These are to get into smaller areas. Both of them are beveled edges. Okay, this is to get into the, maybe like an area like a peroneal or underneath your foot for plantar fasciitis if you want to scan for adhesions. These are excellent. Okay, and then you have the Mallet. It's a little, the Mullet, I'm sorry, there's a little heavier. Okay, but again, knuckles, areas like your leg, greater coverage. Here, probably we can use this for behind the scapulas to try to look for adhesions. Well, not on yourself, obviously, but on maybe if you're doing a partner blasting and you want to, you know, look for adhesions, you can use this in the back for the scap. So I would do something like this to scan for any adhesions, and I have a couple back here, so this is great for that. And last but not least, the Mohawk. Okay, this guy is actually very versatile. It's really cool. So you have your edges, your beveled edges, okay, where you can do your scanning, but then it comes with these amazing sleeves. This one is meant to help mobilize the fascial tissue. These guys you can check for, you have them, Ashley has them on her store. You can check them out. This particular one you can use to stretch the fascial tissue. And you could feel the restriction, but it's good to warm up the area as well, get things nice and loose, because technically your tissues are supposed to slide like this underneath, and so when you have restriction, you're not going to go anywhere. So this pretty much helps move things underneath. So these sleeves are pretty cool. If you want to experiment with it, that's great. Again, we're not doing any heavy pressure of any kind. We're just stimulating everything lightly, stimulating blood flow, stimulating the fluids. This is the neck sleeve. This is meant to stimulate lymphatic movement. Okay, so you would use it like you're using a brush, just to stimulate the lymph. I like to follow the direction of the lymph, and I'm actually picking it up as I'm going back and forth. Okay, so as you see, it'll create a nice little redness where I'm stimulating blood flow. So all in all these tools are amazing. Choose whatever you feel most comfortable with. You know, there's no wrong answer to which tool you want to use, but the way you use them is what matters. So I'm going to show you how you should be using these tools, whichever one you decide to go with, whether you choose one that goes one direction or you choose a tool that has beveled edges that you can go back and forth. It's how you use it. So we're not, again, we're just using them to scan. We're not here to create inflammation with these tools. That's why we have the Fascia Blaster. So let me just grab a little bit of oil. I love Ashley's oil. So I'm just going to show you exactly how you would use these tools. So I'm going to pick one of my tools, which is my favorite tool, which is made by Rock Tape. And that's just my favorite because this is pretty much my partner in crime. I use it all the time here in my practice. So I'm going to start, let's start with, let's say if you have a shoulder problem. So scan for adhesions. See where they're sticky. Again, I have it in an angle. You can see it. I have it in an angle to look for adhesions. And I have plenty here in my shoulder, of course, because of what I do. Massage is what I do full time. It is my only job. So as you can see, I'm turning red already. And that's exactly what I'm looking for. I back off the area and move on to the next area. I know that there are adhesions there, so I can go in there with a face blaster. And I work down the arm, try to look for more adhesions. What could be causing my shoulder pain? You know, and sometimes just because the pain is there, it does not mean that that's where your issues are. It could just be maybe deltoid or bicep, or it can even be down to your elbow or even in your forearm. So these tools are great to scan for adhesions, to see where our problems are. I have a couple in here, right in there, right on the bicep. And then you just move down. Again, be careful with the front of your elbow here. You see you have very delicate structures that run around that area. Okay, and just gently, we're going gently. We're not causing any inflammation. We are just scanning, ladies, just scanning. That's all we're doing. I have more here on my forearm. And then down to your wrist. Gentle motion. Gentle, gentle, gentle. Okay. Into your hands. So this is where we switch it up. Okay. Switch up to something smaller. To look, yep, sure enough, I have it in my thenar, which is my thumb muscle. And in my fingers, I have them. So I use the paddle blaster as my prep tool for my hands because it's amazing. It's so easy. You just rub the paddle blaster back and forth. Get these tissues prepped for some deeper work. And that's it. It's very easy motion. Nothing to blading. Blading is a piece of cake. You go into your fingers to see where we got going on. Into your middle finger, see if there's anything there. I've been noticing, not for nothing, that my index finger is getting a little funky because of the way I hold my cell phone. And my pinky too. I hold my cell phone like I'll use these two fingers to prop my cell phone up. I gotta stop doing that. Those are bad compensations. We don't want that. And the knife of your, the side here of your pinky. We call that the knife. And scan for any adhesions in here. And then, you do your thing. You grab the face blaster and start getting into those areas that are tight. This is where we're facilitating the inflammation process so your body can heal and get rid of all that gunky scar tissue that nobody needs. Okay, because this is exactly where I felt my scar tissue, and guess what? This is exactly where I feel a little bit of pain, right into this area. So we scan with your blades, we prep with your face blaster, paddle blaster, master blaster. We massage with the Big Daddy, the original Fascia Blaster tool, your Mini 1, your Mini 2, and then you refine with your nuggets. Nuggets is amazing. The nugget, let me tell you, the nugget, you can even use the nugget for scanning. I think it does an amazing job with scanning. Let me show you real quick with how do I use my nugget with scanning. Oh, you can use the Mini 1, you can use the Mini 2. But it does an excellent job with scanning if you just go back and forth just like this on the side. If you need to go back in there and find it, if you feel like you've worked enough with your blade, you can totally use this baby to scan and then get in there and refine. Scan and refine. If you feel like you really just want to work with your fascia tools and you don't want to, if you don't feel comfortable with working with blades, you can use your nugget. Your nugget is amazing. Okay, you can even use it with the Mini 1. Scan and then get in there, poke and wiggle wiggle, and you'll feel things start loosening up and your mobility would be much better. I feel a huge difference already. Poke and wiggle wiggle. Okay? Then you got your Mini 1, Mini 2 that has the 2 points. One's wider. I don't know if you've noticed that, ladies. One point is wider than the other one. How cool is that? So you can use the wider edge to scan. Scan for stuff. Or I'm using it at an angle. See that? Angle. And we're just looking for that flush look. With scanning. Scan, scan. I got adhesions right in there. And then use the pointier one to point and wiggle wiggle. Just like that. Point and wiggle wiggle. That feels amazing. That's it. That's all to it, ladies. That is all to it. I hope I was able to answer some of your questions. If you guys still have questions about blading, please leave your comments and your questions underneath this video. Myself or any of the awesome motivators out there will be more than happy to answer your questions and help you out. I appreciate I appreciate you guys really showing some interest to these awesome modalities, because they are amazing. They're an amazing complement to fascia blasting for sure. And it's, again, we're learning about our bodies, we're learning what feels good to us and what we need to do to continue taking care of ourselves. Again, it's a great pleasure to be here with you guys in this awesome group. I hope you found this video very helpful. Have an amazing day. Take care.